Welcome viewers. Today we will discuss the angiotensin receptor blockers, another class of the drugs used in the heart failure. Angiotensin receptor blockers are only active compounds that are competitive antagonists of angiotensin 2 type 1 receptor. Because angiotensin converting enzyme inhibitors inhibit only one enzyme responsible for production of angiotensin 2, ARBs have the advantage of more complete blockade of actions of angiotensin 2. However, ARBs do not affect bradykinin level. Although ARBs have actions similar to those of angiotensin converting enzyme inhibitors, they are not therapeutically identical. Even so, angiotensin receptor blockers are a substitute for patients who cannot tolerate angiotensin converting enzymes inhibitors. The angiotensin converting enzyme inhibitors are the losartan, valsartan, candesartan, irbesartan, and latest one is the telmisartan. The suffix sartan is the basic identification of the angiotensin receptor blockers that are particularly effect on angiotensin 2 type 1 receptors. You are very much familiar with this pathway when the angiotensinogen is converted to angiotensin 1 through the renin released by the kidney, that is angiotensin 1 is inactive and converted to angiotensin 2 by the enzyme angiotensin converting enzyme, and this enzyme also inhibit the inactivation of the bradykinin, which causes the vasodilation, and angiotensin 2 is which is converted which is effect on the angiotensin receptor type 1 and moreover type 2 also. When the angiotensin 2, it is a potent vasoconstrictor. When act on the angiotensin type 1 receptor cause the vasoconstriction. Here our ARBs effect on this area that inhibit the type 1 receptors, and obviously the effect of angiotensin 2 is been inhibited, so the vasoconstriction will not be happened, aldosterone release will not be happened, sodium retention will not be happened, and etc. And at the end the blood pressure obviously decreased and the vasodilation occurs, but blood pressure is decreased. Moreover, the angiotensin 1 is not only converting to angiotensin 2 by this pathway, but it is another pathway that is regulated by the kinase cathepsin G. We are not concerned with that, so that we are going to discuss the clinical use of the angiotensin receptor blockers. The effective and approved medical clinical use of the angiotensin receptor blockers are the hypertension. All the ARBs are effective in the hypertension. Congestive heart failure, valsartan is approved as a second line therapy if the ACE inhibitors are not tolerated. Diabetic nephropathy is another clinical use of the ARBs. Irbesartan and losartan are very effective in the diabetic nephropathy, so it has been believed that it is superior to the ACE inhibitors. As far as side effects and the contraindications are concerned, these are better tolerated than the ACE inhibitors, and the much reduced risk of the cough and the greater fold lower risk of the angioedema, and moreover the other side effects are very similar to that of ACE inhibitors like the teratogenicity and others. Thanks for watching.